Hello, distance. How are you doing? How's your family? I think you're all well. Now let's start our lesson. So before starting the lesson, I would like to show you a photo, and I want you to brainstorm what we will be talking about. So of course you might have different alternatives, and all of them will be related with the hospital, or doctors, and etc. But today's topic is a role play, and let's see what we are going to do today. Okay, in this lesson you will learn new vocabulary related to the topic at the doctors, and then you will practice or role play a conversation at the doctors. So for those students who are unfamiliar with the word role play, according to Oxford Learners Dictionary, role play is a learning activity in which you behave in the way somebody else would behave in a particular situation. For this lesson, it is at the doctor's. So one of you will be a doctor and another will be a patient. By the way, sorry, but for this lesson, in order to practice this conversation, you will need a partner, and of course, it would be perfect, and if there will be anyone speaking English at home. But of course, if you will not find anyone, you can contact your classmates, your friends via Skype, Zoom, or any other programs. And okay, let's continue. A role play. So here's a good example. Role play allows students to practice language in a safe situation. So I hope you understand what is a role play. And then let's continue with vocabulary. Here you can see illnesses, injuries, and symptoms. Now you have to stop the video or pause the video, sorry, and you have to translate these words. I will read them loud, and you have to translate them. Ache, bruise, chest infection, be congested, cough, cut, feel dizzy, feel fatigued, flu, fracture, heartburn, insect sting, feel nauseous, nosebleed, rash, sore throat, sprain, feel stiff, be swollen, temperature, virus, and wound. Now, after you finish translating these words, here's an exercise, easy one. You have to put these words into three groups. The first one is illnesses, then injuries, and symptoms. You can again pause this video, and then we will continue. Now let's continue with another words that are related to treatments and remedies. Here you can see antacid, antibiotics, antihistamine, anti-inflammatories, antiseptic cream, bandage, cough medicine, lots of liquids, painkillers, rest, tablets, throat sweets, X-ray. You will need these words. You will need to know these words when you go to the doctors abroad in an English-speaking country. So after translating these words, we will practice the conversation. Now that's practice time. Well, you have to imagine, please imagine, while on holiday in the UK, you are taken ill, unfortunately, and go and see the doctor. You need to have a conversation with him and her or her and discuss the following points: what the illness is or what the injury is, how long you have had it or how you did it, medicine you can take, a treatment, how much medicine to take, when and how often, and a follow-up visit. After you finish your conversation, please change the roles, and you can also practice with several friends, several partners. And that is all. And you can continue with the exercise that your teacher will conduct to this video. Now, thank you all and good luck.